Gender dysphoria in children is a topic coming up more recently. Children with gender dysphoria are victims of bullying often, and today we would like to educate the public about gender dysphoria in children. So what exactly is gender dysphoria? Gender dysphoria is the distress caused when a person's gender identity is not congruent with their assigned sex. In other words, an individual with the biological characteristics of a male may feel that he is actually a female and may begin to identify in this way. She may detest her biological male characteristics. This condition causes significant distress or impairment in social, occupational, or other important areas of functioning. Gender dysphoria in children is becoming an increasingly prevalent subject. Gender dysphoria is a rare disorder that affects children and can be evident in early childhood. Gender dysphoric children have the potential to suffer a great level of trauma because of what they are dealing with internally and because of societal pressures. Today we are speaking with two researchers who just got done completing research about gender dysphoria in children. They are here today to tell us more about their topic. Can you tell us about some of your research?
I went to Amsterdam and studied children with gender dysphoria, and my colleague went to Toronto and as well studied children with gender dysphoria, and we were observing their behaviors and how they were interacting with their peers.
And what we found was that gender dysphoria can be manifested in a variety of ways. This includes strong desires to be treated as the other gender, wanting to get rid of one's sex characteristics, and a strong conviction that he or her is the other sex. Some of the experiences of children with gender dysphoria include behavioral and emotional problems, social ostracism, peer rejection, and also some psychological problems, including depression. Not surprisingly, peer rejection, bullying, and teasing also occur during this time because childhood is a time when most people are conforming to gender stereotypes appropriate for their age. There's also high comorbidity of other mental disorders such as depression. There's also an increased risk of feelings of loneliness, hopelessness, frustration, and anger. It was also found that people with gender dysphoria have an increased risk of self-harm and attempted suicide.
With all those awful side effects, what are some of the treatments available for gender dysphoria in children?
For children who have not reached puberty yet, the treatment is primarily psychological and psychosocial. The child and the child's parents will need to enter psychotherapy, and the child and their parents may have separate sessions or they may go into session together. It's important for this because they need to gain information about the condition and also potential treatment options. And group therapy sessions may be available for the parents as a means of support. When children get older, other treatments include puberty suppression and also hormone therapy and sex reassignment surgery. These cannot happen until the child is at an appropriate age and the child has undergone psychological evaluation.
With that being said, when is the best time to begin treatment?
The best age for gender dysphoria treatment has not yet been determined. However, suicide attempts and completions were lower in children who received early treatment. Also, children who received early treatment have also shown a reduction in depression, anger, and anxiety.
Talk about some of this ostracism. Why do you think that children with gender dysphoria are treated differently?
This has a lot to do with society and education and how society is used to gender roles and the gender binary, and it also has to do with family issues.
What can we do about this then?
Education is very important. This is why we're here. When people are educated, we are less likely to be ignorant or wrongfully judgmental towards people who are different. We can treat others with compassion. We must understand the difficulty that gender dysphoria may cause children and not embarrass them when they express their feelings. Family therapy is very important. It may be difficult for parents to accept the fact that their little boy or little girl identifies as the opposite gender. It is crucial that families become educated and enter therapy.
Well, there you have it. We've now been educated on this very important topic. For more resources, visit the American Psychological Association at apa.org and type transgender child into the search.